Now, if a parent's starting to suspect that their child can have asthma, what are the signs of asthma that they should be on the lookout for?
The classic sign that gets missed oftentimes is cough. I'll get a lot of patients who have been diagnosed with bronchitis repeatedly, and in the end, it'll turn out that it's not actually bronchitis and they don't need antibiotics all the time, but it's asthma. So if you've got a child who is typically in a situation where they're well, where they have no other illnesses, no colds or anything, they're still coughing at night when they sleep, they are coughing when they run around or they exert themselves. Some kids, the quieter ones, they may not actually be complaining of wheezing or cough. They may just be less active. They'll be more prone to kind of sitting on the sidelines a little bit, but they may not convey to their parents why they're doing that. And they're actually doing that because they don't feel good when they're active, but parents may just think they don't like the activity or something along those lines. So it can be a little bit tricky. Family history is a big one also. If there's a strong family history, you automatically want to be more suspicious of it.
Now, if parents are starting to suspect that their child has asthma and are going in to see their pediatrician, what can they do to get the most out of that visit and to really clarify the question?
The more they are able to observe their child in various circumstances, the better off they will be during that visit, the more fruitful that visit will be. Oftentimes, I'll ask my patients a lot of questions, and at the first visit, if they don't really have a sense or have not suspected asthma, they'll respond, I don't know, to most of my questions, and I'll have them come back in a week or two and say, okay, think about the things we talked about. And things to really look for are, as I was saying, they're not going to be as active. If they are active, they'll stop sooner, get winded sooner, they'll cough a lot more. A lot of kids, especially the younger ones, if they're crying, or toddlers I'm talking about, if they're really upset and they're crying really hard or they're laughing sort of hysterically, they will start to cough when they do that. A lot of kids will wake up in the middle of the night, but they don't really know why they're waking up at night. And they may not necessarily cough, but that can be a sign of asthma. There are some things that should make people more suspicious of asthma. If their kids have significant allergic disease, if their kids have eczema, which is just a condition with very dry, itchy skin, that falls under the sort of broader rubric of atopy, and that should make at least the child's doctor very suspicious for asthma, suspicious enough to at least ask the screening questions to see if they need to continue down that path or not.